Hey folks, Dr. Dan from Doc Talk. Thanks for joining us today on the show. Our guest is going to be Dr. Jim Lillich. He's an equine surgeon and an associate professor of anatomy and physiology here at Kansas State College of Veterinary Medicine, and we're going to talk about navicular disease or navicular syndrome in horses. Stay tuned and enjoy the show.
Closed captioning brought to you by Kansas Soybean Commission, the Soybean Checkoff, Progress, powered by Kansas farmers. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Jim, welcome to the show.
Thank you.
Folks,
Nice
this
to be on
is
here.
Dr. Jim Lillich. He is an equine surgeon and clinician. He also works at as an associate professor here at Kansas State University's College of Veterinary Medicine in the Department of Anatomy and Physiology. And Jim, you've seen a lot of cases and you've worked with a lot of horses, done a lot of surgeries. One of the world's experts, folks, in equine surgery. And we're talking about navicular syndrome or navicular disease in horses. So just kind of what is this?
Yeah, that's a great question. It's a great topic. We could spend hours on it, and you know, if you can lump it into a lot of things, or you can split it, and I like to split it and talk about truly the degeneration of the navicular bone. And there's a lot of reasons behind it, but what it is mainly is an issue with that one bone that's within the horse's foot.
And the impact of that bone is?
It's a vital anatomical structure to allow the horse to do what it needs to do. So we know that for sure that this is a disease that's been recognized for a long time, and we've been fighting it for a long time. And some breeds are predisposed, and other breeds that aren't. In what it boils down to is basically an overload. The bone just can't take what is being given to it, or the biomechanical stress on it, and that leads to several things, repercussions throughout the whole thoracic limb. If we don't walk right because our heel hurts, then higher things get damaged up the leg because we're just trying to get ourselves comfortable, and the horse is going to move to keep itself as comfortable as possible. It becomes a self-perpetuating problem in that foot. So there's a lot of things that it could be, not necessarily the bone, but most of the time it is the bone that's the primary problem.
Okay.
Yeah.
So when we're talking about the navicular syndrome, and whenever we hear that term in horses, it just kind of takes your breath away, because it's not something
people don't want to hear it, and I would definitely it's a terrible thing to label a horse with. And I do believe there's a syndrome and then there's a disease. The syndrome meaning we really don't have radiographic evidence yet that the bone is completely damaged, but the horse still acts like it's lame, and it travels like a navicular horse, or a horse that's lame in its heel. When it's navicular disease, for me, the bone has definitely got radiographic change to it. It's been altered, its shape has degenerated, and then it might be a tougher task to try to get that horse sound or functional.
And it sits in a peculiar, it's in the structure.
Right, it sits in with when it's part of the coffin joint, it's the back part of the coffin joint. There's a bursa, there's a synovial lining that allows the tendon to slide behind it. And it's like it's a bone that takes the slack out of that deep digital flexor tendon as it functions. So with small foot to big horse size, and we've done that with some of our American quarter horses, with more of an upright conformation, meaning the angle between the cannon bone and the phalanges, first, second, third, or long pastern, short pastern, and then coffin bone. If that's more upright, then that bone sees more biomechanical stress than it needs to. And then, quite frankly, poor shoeing causes it well, or poor foot care can really perpetuate it.
Awesome. Folks, when we come back, more with Dr. Lillich on navicular disease and some of the clinical signs.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment.
Mackenzie Steger grew up on a farming and ranching operation in Nebraska. She loved raising and showing cattle and working with local farmers and ranchers. Her passion lies in the cow-calf and feed yard sector of the veterinary profession. After graduation and officer training, she will report to Fort Carson, Colorado for active duty in the U.S. Army Veterinary Corps. As fourth-generation farmers themselves, Heinen Brothers Ag Service understands the risk and rewards of farming. So when it comes to quality aerial and ground application, fertilizer, ag chemicals, and anhydrous ammonia, call Heinen Brothers Ag today, 800-760-4964.
Watch Ag AM in Kansas online at agaminkansas.com. Doc Talk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Jim Lillick. We're talking about navicular syndrome or navicular disease in horses. And Dr. Lillick is recognized internationally as an equine surgeon. He's also an associate professor here at the College of Veterinary Medicine at Kansas State University's Department of Anatomy and Physiology. And, you know, we talked about what it is and how it happens, but what are some of the things that the horse owner is going to see?
Probably the first thing that they see is lameness, and it could be very subtle. Could be I'm not striding out or stepping out as far as I could. A lot of times lameness is perceived as a shoulder lameness, so an upper arm problem, because the horse won't extend itself because its heel is uncomfortable. So he's anticipating putting that heel on the ground and it's not comfortable for him. So that's probably the first thing that they recognize. With time, that can cause contraction of the horse's heel, meaning the heel is not as wide as it should be. It causes some distortion to the hoof capsule because, again, the horse grows that hoof capsule as he uses it. So if he doesn't use it correctly, the hoof capsule doesn't grow correctly. So the lameness is probably the first thing that you recognize. And it's an intermittent lameness. The old term for it was, a long time ago, was intermittent claudication. It's a fancy word, right, for just he's lame. So I think, usually a dominant leg, it's a bilateral problem, but it's usually one leg that causes more of an issue than the other. So the clinical signs not performing like he used to, lame, hoof looks a little bit different, doesn't want to do his job like he used to, and hopefully that doesn't progress to a full head bobbing lame, like especially at the trot. That's where we evaluate most of our lamenesses. So those are the main clinical signs.
And so when someone's looking at lameness, let's just go through some of the as you increase in severity. You made the mention of head bob and things
right.
like that. What are some of the things you kind of train clients to look at?
Well, the veterinarians look at it a little bit different, and everybody's got their way of doing it. But for clients, it's a little hard to explain because the AAEP scale goes 1 through 5, and it's really categorical data, it's not numerical data. So when you see a head bob in a horse, meaning the head comes down on the sound leg, he's moving the weight from the unsound leg or the unhappy leg to the happy leg, down sound is what we usually say. He's just moving his weight over. So I ask a client, can he switch leads correctly? Is it one leg versus the other? When the horse starts to show obvious lameness just at the trot, then that becomes problematic. It means he hurts well enough that he can't hide that bad limb anymore.
So the first thing you see is kind of a difference in the stride, shorter
stride,
not reaching as far, hoofs growing differently, and then when they become more lame, it's down with the sound.
Yeah, that's the easiest way to look at it, and sometimes it'll get worse when the leg's on the inside of a circle. So if they were to lope the horse or jog the horse to one side, the affected leg usually is more evident on the inside. So if it's the left leg when they're going to the left, it's the right leg when they're going to the right.
Awesome. We're going to take a break. More with Dr. Lillick after these messages. You're watching Doc Talk. Thanks for joining us.
No matter where, no matter why, The Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why Doc Talk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
The Kansas Wheat Innovation Center in Manhattan is rediscovering ways to get improved varieties and new genetics in the hands of farmers faster. Grower-led and checkoff-funded research initiatives are bringing about positive change. This grassroots leadership provides a strong voice in Topeka and Washington, D.C. Now is the time to partner with Kansas Wheat in moving wheat forward. Kansas Wheat Commission and Kansas Association of Wheat Growers. Farmers investing in their future and yours. Log on to rediscoverwheat.org.
I'm Dr. Frank Lyons, a physician here at Kansas Regenerative Medicine Center. As one of the only standalone stem cell centers in the U.S., we use your stem cells as therapy for arthritis and some autoimmune diseases.
I'm Dr. Andrew Pope. Here at Kansas Regenerative Medicine Center, utilizing the latest technology under strict protocols, we're able to harvest your stem cells from your own fat to treat a variety of medical conditions. The best part about it is, it's a same-day surgical procedure and requires no general anesthesia.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Doc Talk, brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with my friend and colleague, Dr. Jim Lillick. We are talking about navicular disease in horses, and Dr. Lillick is an internationally recognized equine surgeon and is an associate professor in the Department of Anatomy and Physiology here at Kansas State University's College of Veterinary Medicine. Tickled to death to have you on the show today. Thanks for sparing your time and your expertise with us. So now, my horse is lame. I need you to fix it, Doc.
Okay. All right. So there's been a lot of treatments throughout the history of this disease to try to make it better. From injection of toxic substances to changing of what have you to, and you can go right down the line with them. But the tried and true is, let's get the shoe and the shoeing corrected. Let's get the horse a foot that he can use and work with. So if he loads it correctly, we're headed in the right direction. Certainly pain relief plays into that as well. The mildly affected syndrome horses probably can get through with a case of with some anti-inflammatory, some non-steroidal anti-inflammatory, phenylbutazone. When they start to get more affected, more alterations to the bone, we get a little bit more aggressive with the therapy. We try to deliver an anti-inflammatory that is more in the area of where it's needed. So those would include coffin joint injections or even navicular bursa injections. We're trying to put medications exactly where they're needed. I know that probably doesn't go anywhere unless the horse has got proper shoeing. And I've got a lot of good friends that are shoers, and they teach me a lot about this disease. And one comment just the other day from someone I know said, the more I do this, I think I have it figured out. The more I recognize I really don't have it figured out. So you have to have a shoer that can recognize the individual and get a shoe that works for the horse so he can actually use the leg.
Talk to me about the different kinds of shoes or what you're talking about with, where are we trying to get that horse to load then? Stay off the heel?
Well, we need to support the heel, and part of it is the heel needs to spread and flux when there's weight bearing.
Okay.
And when there's no life in that heel, so to speak, meaning it should expand normally as it's weight bearing, and the horse puts weight on it, and when it hurts, he doesn't do that anymore. It just lifts up. Part of that is the shoeing and potentially a nail just too tight, and we're not allowing that shoe to spread. We want the breakover to be as quick as possible. So we roll a toe, we rocker a toe, we do something so when the horse picks the leg up, it wants to move forward. And then we support the heel, maybe with the shoeing just a little bit full, so that when the shoe hits the ground, it takes the brunt of the load first before it reverberates up the body. The egg bar was something that people have used. In the right hands, the egg bar is very effective. I think also the egg bar might be seen as a get over the hump shoe, and then you get back into something a little bit more normal, so to speak. But growth and changing the foot growth could take you several months, if not a year, to do. And there's other medications that are out there. People are using stem cell therapy. That's yet to be really documented, proven to work. Children therapy, which is a drug that doesn't allow the bone to remodel. Some horses respond, some don't. Biggest thing we do is shoeing and some pain relief. Yeah.
Awesome. Well, when we come back, we're going to discuss more with Dr. Lillick about prevention of navicular disease and different things you can do to prevent lameness in your horses. Thanks for watching Doc Talk. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Hello folks, Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to visit about heat stress. I oftentimes talk about heat stress in cattle with managers or producers in terms of the variation in temperature for these cattle. The way I really want to put it to you is these cattle stay outside all day, every day, adjusting the temperature swings from 30 to 40 degree temperature swings. To put it in our terms, or what we can relate to, is if you stayed in your house all day, every day, and if you adjusted your temperature on your thermostat from 40 degrees to 70 degrees, you're going to experience a very big discomfort. Same thing's going to be if you go up from 70 to 100 degrees temperature swing in your own house. You're going to experience some discomfort. So for these cattle, we want to pay attention to these temperature swings. We want to do the right thing, handle them early in the mornings. Don't handle them in the heat of the day. We want them to be able to sit, rest, and do their thing in their pen while it's hot, left unbothered so we don't cause them any undue heat stress. That's today's tip of the day.
Healthy cows start with the new Hired Hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new Hired Hand for yourself or become a distributor. Visit cowsprayer.com. The new Hired Hand makes healthy cows easy.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Buying a car shouldn't be this hard.
And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
Here's another gardening tip with Annette Jackson from Jackson's Greenhouse.
Fresh herbs are healthy and add zest to almost every recipe. The folks at Jackson's grow more than 50 varieties of herbs right here, and many are available year-round. Our staff has hands-on experience and can't wait to assist you with your herb needs. Stop in and see us at Jackson's. We're open 7 days a week.
The biggest, largest selection of homegrown herbs is at Jackson's Greenhouse, with 4-inch pots starting at just $3.79.
Jackson's Greenhouse has what you need today.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Jim Lillick, who's an equine surgeon and an associate professor at the College of Veterinary Medicine's Anatomy and Physiology Department. We are talking about navicular disease. We've talked about what it is, clinical signs, gone to the treatment, and now is there any way to work with your horse or things you can do to prevent lameness or prevent this syndrome?
For sure, I think there is. The ounce of prevention is worth a pound of cure. I think that holds true for this particular problem, and might be the poster child for it. When you go down and you're starting with a young horse, you can't emphasize getting their feet right and shoeing them correctly from the start is pretty important. But when that horse goes into training, he's got to have a foot that he's real comfortable with using, and if he uses it, then he's gonna harden his body up. It's going to harden muscles, bones, etc. in order to take the training. They're bred to be athletes. But if you neglect the footing, the shoeing, and the foot care, then I think you're going to run into problems. Some horses are going to be predisposed to this based on, in some instances genetics, and in other instances use or a combination thereof. But if you can slow down the perpetuation of the problem, sure. I think that's very important. So shoeing, and keeping the young horse trimmed, making sure when you go to train you don't overdo it, and keeping an active eye to make sure that you're not developing an issue. And we see a lot of young horses with some change to their bone with 3 or 4 years of age, and they've already got the problem, and that means their quality of life might not be very nice when they're 14 or 15, and their use is going to be restricted.
I kind of liken it to these athletes today. Every one of them wears custom fit orthotics in their shoes.
Yeah, exactly.
Because they're going to be worked hard. They're going to have to do the job, so they've got to have something that
Yep.
properly loads the bones of the feet,
right,
and lower extremities.
Exactly, and that has repercussions higher up the leg too. So prevention, foot care. Make sure that you have a farrier, someone that really knows how to trim, get the shape of the foot as symmetric and as normal as possible, and make sure that shoeing or foot is at least ready to work, and then the surfaces that you use to train the horse on. I mean, they should be solid, good surfaces, and in the state of Kansas, we can't always predict that, right? With the rains and hard, rocky pastures, and arenas can all be different. But if you start with foot care and do proper training, proper warm up, proper work, proper cool down, and it takes diligence. For the most part, you can probably be ahead of the curve and not have to come see somebody that is going to tell you your horse has got navicular disease, and the only thing we can do is actually cut a nerve to make him more comfortable, and that's only going to work for a couple of years. Yeah. So and that's really a disappointing place to be for everybody, the horse, the client, and the veterinarian.
Yep. Well, thanks a million for being on the show.
Thank you for having me. Appreciate it.
Folks, Dr. Jim Lillick here at the College of Veterinary Medicine. If you want to know more about what Dr. Lillick and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local practitioner. I'm Dr. Dan Thompson. You've been watching Doc Talk. We're sure glad you joined us today, and I'll see you down the road.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff Progress, powered by Kansas farmers.